So let's talk about how effective is the genicular artery embolization procedure, or the GAE procedure. And the short answer is it's very effective. When it comes to certain types of issues, the procedure definitely can be head and shoulders above any other treatment option. Really, the niche area where this procedure does really well is for patients who are contemplating having a knee surgery or cannot have a knee surgery. So there's going to be a large population of patients who are kind of at the end of the rope, and their doctors are saying, hey, you need to have a knee replacement. And for a number of reasons, they do not want to have the knee replacement or cannot have it. And this procedure then comes into play where, they failed injections, they failed other physical therapy kind of things. And the procedure can be very effective in controlling their pain. Almost 80–90% is what the reported literature is stating out multiple years. Very rarely does a patient need like a repeat procedure, only because some of these blood vessels can grow into other areas and you get inflammation in a different part of the knee. One of the things patients need to understand on how the procedure is performed is that we only go after the area that is actually causing the pain. So first thing we do is we localize where the pain is. We put a little marker exactly pinpointing where your pain is, and then that allows us to then go in and close off the little tiny blood vessels in that area that is causing the inflammation. Meaning that you may have another part of the knee that develops pain, in which case later on that may be another area that we have to go back embolize that area. So it's not a spray and pray type of a procedure. It's a very precise type of a procedure, controlling and targeting pain only where it is actually originating. So this is why the procedure works so well for patients. Even 20% of patients who have had a knee replacement, they have residual pain that just doesn't go away because of inflammation. It's the same thing. We can go in there and target. Now, the other big benefit with the procedure is there's very little downside. The risk of the procedure is almost minimum to none, meaning that starting an IV in your foot or your leg, the complication from doing that, the IV is needed to actually do the procedure. That complication risk is so little. The main thing that you may worry about is that the procedure just doesn't work in effectively controlling your pain. And that's only about 5–10% of the patients will state that they didn't get significant pain relief. And our benchmark is really at least 50% pain improvement. So to have a successful outcome, 50% or better pain relief is what we're targeting, and that's over 90% of the patients who actually have the procedure will actually state this. So hopefully you found this information useful. By all means, definitely reach out to us. Give us a call on the number that you see, or make an appointment to see one of our specialists in our facilities so that they can sit down and go over outcomes with you in person, explain whether you're going to be a good candidate and whether you're going to get significant relief from this GAE procedure. Take care.